Hey everyone, thanks for joining us. It's Alicia and I'm here today with Dr. Carmichael of Rockside Family Dental Care. How you doing?
I'm doing great, thank you. Good to be here.
Of course. Good, yeah, it's good to see you. So today we're talking about tooth sensitivity. So maybe, for me, I know my teeth are pretty sensitive when it comes to eating cold things. I can't let those cold ice creams or anything just sit on my teeth for too long because I definitely feel a little bit of discomfort. So I'm sure that there's a lot of other people who have different sensitivities to different things. So I want to just dive into that a little bit today. So let's go ahead and just start by talking about what causes tooth sensitivity.
So great questions. There's numerous things. Sometimes people will have, we call it exposed root surfaces, where maybe their gums have receded a little bit over time, and it exposes the root surface of the tooth, which can be real hypersensitive. Things like ice cream, like you were saying, cold things, cold drinks. Usually it's more cold sensitivity, but some people complain about, their coffee being too hot and that bothers them. So that's a very common type thing. It doesn't necessarily mean that you have like an abscess tooth or something like that. Now, if it's localized to one particular tooth, where every time you have something cold, it could mean that there's something going on with that tooth. Maybe the nerve is irritated, and that's definitely something that should get checked out, or maybe there's like a little crack in the tooth. But there's certain things that we can do too for the sensitivity. Easy things that patients can do at home is they have all different kinds of sensitivity toothpaste out on the market. Sensodyne, Crest, all the big name manufacturers have their own version of that, and that can help too. And then as far as more sensitive teeth on there, besides doing things like that, we can do things like a fluoride treatment when people come in for their routine exam and cleaning, and that can help with the sensitivity too.
Okay, yeah, and we actually have some videos out there on your blog about fluoride treatments even, so you can get a little bit more information on that too. So what type of things do you think that a patient should be avoiding if they do have tooth sensitivity? Is it just hot things and cold things, whatever causes the irritation?
So what I would say is, if you're really aware, say for example, like ice water, maybe drink it at warm temperature, or room temperature, not warm necessarily, but just a little more mild, so we're not on the extremes. Most of the sensitivity is quick. It comes for just a second or so and then goes away. If it tends to linger for a long time, then maybe we need to see that patient and check it out too. But brushing your teeth, keeping the surface of the teeth really clean, also helps with the sensitivity, because those bacteria can cause some of that sensitivity on those teeth.
Right, absolutely. Well, thank you so much for addressing that and outlining some of the things that patients can do, and then things that you at the dentist's office can do as well. So if you are, did you have one more point?
One other thought on there. So
yeah, of
even
course.
like avoiding chewing ice and things like that, that's super sensitive. So that's a big one. So I didn't mean to interrupt. That's good.
Yeah, absolutely. Yeah, I can definitely see where that would cause sensitivity. And if that's something you're experiencing, please reach out to the team at Rockside Family Dental Care if you have any questions, or if you think that you should come in for an appointment. If this is just like a lingering tooth sensitivity that you can't, get to stop, like Dr. Carmichael said, it might be something that you would be worth to get checked out. So make sure you're doing that. Give them a call, explore the rest of the blog to learn more about similar topics such as this, and make sure that you check us out next week for the next one. Thank you.
Thank you. Have a good day.